We have some minutes left, and I have asked Jonas and Öystein to comment, because in one of the articles that is in the issue of Socialmedicinsk Tidskrift, Jonas has developed an article where he put up an hypothesis on how does this work, what is the causality lines, and how should we interpret this? And you, Öystein, made a very similar one. And I want you to both to comment on that as finalized, because this is about causality. What's behind? How could we explain this?
No. Okay.
I haven't read that paper with the Socialmedicin.
But I think you can
Okay.
elaborate anyhow.
Well, we have a rather similar points of view than I discussed from an infection-induced autoimmunity as an explanatory model. And actually quite a lot based on your results on the rituximab effect. Mitochondria then have been implicated in many situations, like the difficulty for energy metabolism, the aerobic energy metabolism. So that put the spotlight on mitochondria. So judging from those results, one could argue for an ATP shortage in this disease. But then these metabolic changes, they are very complicated. It's hard to see the big pattern, but Anders Rosén gave us some great explanatory models for that also. So that was about my model, and it's rather similar to yours, isn't it?
Yes, I'm not sure what to say to that, but I will just comment on that, the biomarker perspective first, if I can do that, because in oncology, we are overwhelmed by biomarkers for one thing and another thing, but that's composed of gene expression data sets. You do analysis of many thousand variables. You put out those 15 that are most significant and try to establish a signature, which breast cancer patients will respond to treatment, who will not. The big problem with these are that if they are not anchored in biology, and if you don't understand what these 13, for instance, that you find in or 70 gene signature, for instance, if you don't understand what they tell you, it's very difficult to use it as a biomarker. And if you do very non-overlapping sets with, let's say, 100 patients in different patients, you will most certainly have non-overlapping genes also. I think that it's preliminary to make a biomarker based on these 600 metabolites you have to analyze, and you have a small patient population, and you put out those that are most significant, but you really don't know what that tells you in biology and in the clinical world. There's one reason why estrogen receptor is still one of the most important predictive markers in cancer, for breast cancer. Even though you have thousands of genes in many different analyses that can tell you statistically more about how to differentiate between groups. But that's because you know what it tells you. It tells you that you can use endocrine treatment. I think the same will probably be true here. We need to understand why this lack of energy. I completely agree with you, and that is one of the problems. One of the problems the patients tell me is that they have lactate in the muscles. I had one patient with severe disease. She's going to do this POTS test that Lucinda told us about, 10 minutes. She's bedridden almost. She's been standing for 10 minutes. after 5 minutes, she said, I feel my lactate is overwhelming me in my muscles. And I ran and took the lactate measurement, and she had 8.5. That's what you have when you're running over the, when you have running marathon. Very high levels, just from standing upright. That tells me clearly something wrong in the metabolism, in that axis, ending up with lack of ATP. And so I think the mitochondria are in focus. How they are in focus is probably something to do with the initial event. I guess the immune response somehow. That's what you have also been touching in your previous papers. The immune response to maybe some kind of molecular mimicry and targeting the cell's ability to make energy.
Thank you.
I'm not sure if it was an answer.
Yeah, okay.
Okay.
Very good.
Probably
thank you.
not.
Thank you. Well, the aim of today, I think, was to give the forefront of research regarding diagnosis, treatment, and causality. And I think we have got there, and we know in the discussion there are now hypotheses that are rather interesting or very interesting. With these words, I think we can end, and I thank you all. And